So our research was to look at the medical accuracy of the information that is provided on sexual and reproductive health on various websites. The way that we went about this is we did a Google search for phrases such as birth control, sexually transmitted diseases, emergency contraception, IUDs, and looked at which websites were the top 10 to 15 that came up on each of these topics. And then we compiled them into a master list of the 35 top websites for this kind of information. And we also asked physicians and other medical providers what websites they prefer and what they refer their patients to. So in our study of 35 websites, we then looked at 26 medical information, such as, do they recommend IUDs to adolescents? Do they state that emergency contraception is not an abortifacient? Do they dispel the common myths such that that birth control pills will make people gain weight? And then we evaluated them. So with my wonderful undergraduate student, Alicia Tolani, she was the one that did most of the work, and we're proud to announce the results of that study today. The main findings of our research study were that there were 6 medical points that we want to make sure that young people and that physicians know and get out there to dispel the myths that are out there on the websites that we found. So the top 6 things that young people should know that aren't covered by the web or currently are being covered inaccurately by the web are: number 1, that emergency contraception is over the counter for those 18 and above, and by early May 2009 it'll be over the counter as well for 17-year-olds. For those that are younger than that, there are 9 states in which young people can go directly to the pharmacist and choose this last chance to prevent pregnancy. Number 2, that emergency contraception is not an abortifacient. It does not cause an abortion, and it is not the same thing as RU46. Again, it's a way to prevent pregnancy. Number 3, IUDs are safe to be used by adolescents, and even if you've never had a child, never been pregnant, or if you have partners but hopefully serial monogamy, IUDs are perfectly fine and a great method to prevent pregnancy in young people. Number 4, that if you take birth control pills, you will not gain weight. Some people, maybe 1 in 1,000 may gain weight, but in general, the research shows people do not gain weight on birth control pills. Number 5, that if you're a young woman, you do not need a pap smear until 3 years after you begin having sexual relations, or 21, whichever comes first, unless you have HIV or are immunosuppressed. And lastly, for everyone, herpes can be transmitted by kissing, and those are the top 6 facts that we want to make sure young people, everyone knows, but particularly providers as well, to counteract the myths that are out there. So based on our review of the top websites that came up when people Google things such as STDs, emergency contraception, or IUDs, the best medically accurate websites that we would suggest are Ask Alice, which is run by Columbia University, youngwomenshealth.org, which is run by Harvard, Teens Health website, which is kidshealth.org, which we believe is run by the American Academy of Family Practice, and teenwire.com, which is run by Planned Parenthood. Those are the top 4 websites that have the best medically accurate information regarding adolescent health, sexually transmitted diseases, and birth control. So if you're a young person and you want information, or if you're a provider for young people, these are the top 4 websites that we would recommend at this time based on our research here at Lucile Packard Children's Hospital.